We're having the issues with testing for the same reason that we've not contained the virus, whereas so many other countries have. We've just not had a coordinated federal response, and we still have the epidemic raging across the southern states and into the Midwest.
And that's becoming an increasingly common refrain as the pandemic continues, that the lack of a coordinated federal response has made it nearly impossible to stop the spread of COVID. In our last segment, we spoke with the head of the largest teachers union in the United States, and she shared her concerns about sending both faculty and kids back into the classrooms. Our next guest speaks to the medical perspective. Dr. Eric Cioe-Pena is an emergency room physician for Northwell Health system. He's also the system's director of global health. Dr. Pena, I'm sure you saw the headlines this week. Nearly 100,000 American kids tested positive for COVID in just the final 2 weeks of July. 338,000 positive kids since the start of the pandemic, and we still don't know if they've spread it to others or to how many others they may have spread it. Given that, in your mind, is it safe to reopen schools, not just in places like Texas where it's still out of control, but even in places like New York where they've announced that schools can reopen and where the virus is under better control?
Yeah, I mean, it's a very complicated situation, right? I mean, because there are clearly benefits to children having in-person learning, and those are very clearly demonstrated. And so there is this goal to keep kids in school in a more regular environment where their social and emotional development can also occur. We have to balance that with the risk. Certainly in places like New York where the prevalence is low, and we hope that it stays low, I think there can be safe reopening plans, but they need to be responsive plans, and they need to respond to when there's an outbreak at the school and also when there is an increased prevalence in the community. And we need to be able to transition very quickly between remote learning and in-person learning if we're going to do it. In places where it's out of control, like Texas, I think it's irresponsible to open the schools.
You know, I saw an interesting chart that speaks to spread and risk. The chart plotted states that had large numbers of people who came out for protests against the rates of transmission. And at least on this chart, it found that states that had more protesters had a lower spread. No, I'm not remotely suggesting that that is conclusive at all, but it did feed into some messaging, and I wanted to run it past you, that the biggest dangers right now, as best we know, are prolonged exposure to other people in indoor settings, which could impact things like movies, the theater, malls, concerts, sporting events, and yes, schools. Does that jive with where we are in terms of what we know about the spread?
100%. Yeah. I mean, right now, the way that we think COVID is primarily transmitted is via direct person-to-person contact indoors with people not wearing masks. And anytime you get closer to outdoors with masks, which is I view the lowest risk, you're getting a little bit better in breaking the cycle of transmission. So the worst case scenario is everyone is indoors with no masks on. And the best case scenario is everyone is outdoors, socially distanced with masks on. And that's the best way to, right at this point, to break the cycle of transmission. So we need to make schools look as much as possible like protests.
And so the more time that you're indoors with somebody, the greater the risk, all the way around the board.
Correct. Well, I mean, the risk is mitigated a bit with face coverings, but absolutely indoors is the riskiest. Poorly ventilated indoor areas are probably the worst. But, I've been working with lots of schools lately, and our main goal is to have as much classroom activities outdoors as possible, and then to create a ventilation scenario within the indoor environment so that it mimics outdoors. So having windows open, having kids in masks, those are great mitigation strategies to try and get in-person schooling to happen.
I wanted to ask you about testing and test results. We're still hearing that in a lot of places, it's taking longer than a week for results to get back. We're still hearing about testing problems. Just remind our viewers how delays in getting test results back hurts the effectiveness of those tests.
Yeah, so I mean, part of this is the volume, right, and handling the testing volume. But certainly, if you have scenarios where you're not getting tests back, you won't know the result for 2 weeks. It makes it almost a useless test because it's impossible to contact trace, because you'd essentially have to contact trace everybody that gets submitted for testing, not just the positives. And it also makes it very, very hard to make a decision on whether a child can come into school. A lot of the things that we're working with on schools is how do you deal with symptoms that may not be related to COVID, runny noses because of fall allergies. And responsive quick testing would mitigate a lot of those risks and make it a lot easier to make decisions about whether individuals that are participating in school have to quarantine or do remote schooling for a period of time. A 2-week turnaround time on a test just makes that impossible.
You mentioned contact tracing. Is that even possible in out-of-control areas like Texas? And in places like New York, where the virus is more in control, do we have proof that it's working?
So contact tracing only works when the prevalence is low. When you have widespread community transmission, it is virtually impossible and also very ineffective to contact trace because you just don't have the ability with high case numbers to determine when you got infected, who you may have infected. It's too long of a time frame with too many contacts. In places like New York, for this epidemic, I don't think we'd have data yet that it's effective, but it is effective in other epidemics. It's one of the basics of epidemiology. And in low prevalence areas, it could be highly effective in containing the outbreak and preventing it from becoming community-wide. And I'll give you an example. If you contained an outbreak to just one classroom pod within a school, and isolated and quarantined that classroom, the rest of the school can continue to function. But that has to do with cohorting groups of people and good contact tracing.
Getting news about vaccines from two men I do not trust at all. Vladimir Putin says Russia has developed a vaccine. President Trump is claiming a vaccine is right around the corner. He even mentioned Election Day as a possible target. I don't have a lot of faith in either claim. I'm wondering if you do. And then also just a reminder to people that Vaccine Day isn't going to be like VE Day with everybody packing into Times Square to celebrate. Lives are still going to be at risk even after we get a viable vaccine, right?
Correct. Yeah, we have to ramp up production. We have to distribute it. We obviously should distribute it to frontline workers and then in order that way. We definitely, given Russia's announcement, they basically said that they have a vaccine candidate that they've developed, that they're skipping phase 2 and phase 3 clinical trials, and that they're marketing it, which, we have 2 vaccines in phase 3 trials. So by that definition, we already have 2 vaccines, but we have chosen not to skip steps to make sure it's a safe and effective vaccine. And so I can't really speak to any specific timeline that neither world leaders, as you mentioned, said. I think that we will have a vaccine as quickly as we can have it safely, and then we'll begin to distribute it as efficaciously as possible.
Trump also said he's thinking about trying to block Americans who might be COVID positive from re-entering the United States. Emphasis on the word might be positive there. Given all the community spread in the U.S., would that have any real impact on our national struggle here? And what could that mean for Americans who are testing positive or thought to be positive who can't come home?
Yeah, so I see it as having zero impact on curtailing the epidemic. The United States is currently the world epicenter of COVID. And so it offers no protection at all. In terms of security and safety for our citizens abroad, the right to repatriate, it's better to ask a constitutional scholar, but I think that's pretty much a constitutionally guaranteed right. And if I were sick abroad and I had health insurance in the United States and wanted to come back to my country to get medical care here, I think that that's something that I should be allowed to do. So I don't. I'm speaking more personally here than as a doctor, but I'm questioning the efficacy, and it has large downsides.
Finally, Dr. Pena, lots of people, ourselves included, in all likelihood, pining for normal, things to return to normal. I'm already seeing worries that we're going to lose Halloween this year, and another suffer for something for our kids to suffer through. Do you see normal anywhere in our future? And if so, how and when can we get there?
Yeah, so that's a great question. I don't see it in the near future. I think we need a vaccine, herd immunity, and hopefully through vaccination and still some good hygiene measures to break the cycle of transmission in order to return to something that resembles normal. But certainly 2020, I don't see that has a high likelihood of recurring.
Dr. Cioe-Pena is an ER doctor at Northwell Health. He is also the system's director of global health, and he has been a frequent guest on this program. As always, doctor, really appreciate it.
Thanks to me. Good to be here.
And up next, tens of thousands of American families have been impacted by COVID, and scores of healthcare workers on the front line have also been traumatized. After the break, a few of those medical professionals share their emotional stories.